Hi, I'm Michael Singh, Associate Professor of Surgery at the University of Rochester Medical Center. I'd like to talk about vascular disease and how it relates to men. Vascular disease affects all men. In reference to the upcoming conference, we'll be focusing on atherosclerosis, which is hardening of the blood vessels. We'll focus on hardening the arteries of the neck, which is known as carotid arterio-occlusive disease, and in turn can lead to men having strokes. It also affects men with their legs. That's known as peripheral arterial occlusive disease. And this essentially affects a larger number of patients, men in particular, throughout the United States. It's important to acknowledge that hardening the arteries and vascular disease happens to be the #1 leading cause of death for all men in the United States. There are many risk factors that men have that lead to the progression of hardening the arteries. Some of these factors are age over 50, a history of high blood pressure, a history of high cholesterol, those who are smokers or have a history of diabetes. Family history is a very dominant factor that clearly leads to progression of atherosclerosis in a subset of patients. Other factors that are important to acknowledge would be lifestyle. For those individuals who are heavyset or obese, clearly they are at an increased risk for having progression of hardening of the arteries. Those individuals who have a sedentary lifestyle or choose to be the couch potato also put themselves at increased risk. Also, those individuals who choose not to participate in exercise or smoke, 15,000 Americans will die from ruptured abdominal aortic aneurysms on an annual basis. Ruptured abdominal aortic aneurysms are the 10th leading cause of death for men in the United States. When the carotid arteries, which supply blood flow to the brain, become blocked off, or small particles of plaque break free and go to the brain, a stroke will occur. This affects 700,000 Americans on an annual basis, and with that, 400,000 Americans will die. This has become the 3rd leading cause of death in the United States on an annual basis. Another factor that we need to take into account is peripheral arterial occlusive disease. This happens to relate to hardening of the arteries in the legs. This in its own right affects 14 million Americans on an annual basis, the majority of which are men. There's a strong correlation between hardening the arteries in the legs and that of the coronary circulation. So it's very easy to see that additively, hardening of the arteries and vascular disease clearly are the leading cause of death, and certainly are something that we can augment by modifying some of the things that we do on a daily basis. There are many aspects about vascular disease that are fairly apparent and well known to many, but one of the biggest challenges that we have is the unknown. For those patients that have hardening of the arteries, they may have minimal, if any, symptoms. And in these situations, it's so important that routine screening and evaluations by the primary care physician is performed. For those individuals that are placed at a higher risk, these individuals should be screened a little more closely. Routine screening is pain-free, cost-effective, and quickly can be performed. Here's the good news about vascular disease, and hope should not be lost. There are many things that we can do with our daily activity and our lifestyles that can slow the progression of vascular disease, specifically atherosclerosis. Some of the most important factors will be making sure that you see your physician on a regular basis, eating a low-fat, low-cholesterol diet, exercising regularly. As little as 3 days per week can make a significant difference. Stop smoking, one of the most important factors that we can control. Losing weight, and in turn making sure we comply with the medications that are prescribed for us. Most important, our blood pressure medications, aspirin, and our cholesterol medications if there's no contraindication for them.